Whenever I ask someone,
Are you taking any supplements?
the answer invariably will be
Yes.
No.
if the answer is yes, my obvious next question will be,
Which one?
and the most common answer will be,
A multivitamin.
A multivitamin.
if the answer is no, the next question I get asked is,
Do you think I should be taking?
A multivitamin.
for those already taking a multivitamin, if I ask,
Why are you taking a multivitamin?
the usual answer is,
To stay healthy,
Come on now. I thought you were a doctor.
you should know this now.
Well,
Americans were projected to spend approximately $35.6 billion on dietary supplements back in 2022. I am sure the numbers have increased since then. Being a doctor, I am aware of the importance of vitamins and minerals for our body. But if you think about it, that's a lot of money for products that show little, if any, evidence of benefits. And the big question remains,
do you need to take a multivitamin to stay healthy?
hi, I'm Dr. Sanober, Pezad doctor. I'm a board certified dermatologist practicing integrative and holistic health, and on this channel we discuss everything related to skincare, haircare and healthy aging. In this video, I will answer this question along with some other important topics like who should take a multivitamin, for how long should you take a multivitamin supplement, and which ones to choose. So let's get started.
Let's first learn to look at the labels.
A dietary supplement is an umbrella term that includes everything from individual nutrients such as vitamins A, B, C, D, E, K, and minerals like calcium, to multivitamins and specialized senior formulas that contains various combinations of vitamins, minerals, phytonutrients, and other compounds.
Then why do people buy so many?
You can kind of blame clever marketing and loopholes in the federal guidelines. The FDA regulates dietary supplements as a subcategory of food, but not as a prescription or an over-the-counter drug. This means the FDA only monitors claims on supplement labels regarding disease treatment. For instance, dietary supplements cannot make claims about treating specific diseases on their labels, like
Lowers heart disease risk,
or
protects against dementia or memory loss,
yet. The guidelines will allow phrases like
promotes heart health,
or.
supports immunity.
However, any such phrases must be followed by the words, "This statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease." I'll try saying it like they do it in the adverts.
This statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
This kind of ambiguity means sky's the limit for how manufacturers can present their products. And many people don't realize the difference. They see heart health and think it is beneficial for the heart, even though there might not be anything in the product that specifically proves the effectiveness conclusively. There are multiple studies and reviews that have found that taking extra vitamins and minerals doesn't protect against disease or improve overall health in otherwise healthy people. Now, did you pay attention to what I just said? I said it would not improve overall health in otherwise healthy people. So the next question is,
who is healthy? And what does health mean?
To be honest, the conventional Western allopathic system is not always interested in optimal wellness, because there are a lot of other factors that need to be taken care of, quite honestly. The moral is people are healthy until they are diagnosed with a disease, upon which they can be prescribed a pharmaceutical drug to help take care of the symptoms of the disease. When I realized this, I sought to study more, and hence you see the list of certifications ahead of my name. But that's the truth. For years, the definition of health was the mere absence of disease. I won't get into the nitty-gritty, but times are changing, and traditional healthcare is opening its eyes to how to perceive health and overall prevent disease. And there have been some leaping changes already made. That being said, let us then understand
what's the problem with a daily multivitamin.
In general, the consensus is that healthy adults don't need any dietary supplements.
But what if you don't eat right all the time? Should you pop a daily multivitamin only for good measure?
This is a question I debated myself for years, and it is only with a lot of clinical and personal experience that I've come up with my opinion. Different doctors will have different opinions about multivitamins. Some take a
Might help, won't hurt approach.
to fill in the nutritional gaps in one's diet. Others believe
They are not necessary.
In this day and age, I have seen how difficult it is to get all the nutrients you need through food alone. Truth be told, even if you're trying to source the best, the soil quality isn't what it used to be. There are a lot of factors that have changed in the environment and the human physiology as times have changed. In fact, even the recommended dietary allowance of vitamins and minerals that you see, the number you see doctors and researchers quote, it is just the minimum amount of those nutrients required to prevent a disease from occurring. It does not factor in staying healthy at all. In the end, it all comes down to what I have always taught you.
Bio-individuality.
You have to assess
Whether you need it.
if you feel you need a multivitamin, then there is no harm in taking one. Unless you are mega dosing, most multivitamins are safe and should not cause any adverse effects. But realize that multivitamins have their limits. They may offer extra vitamins and minerals that you may occasionally lack from your regular diet, but they are not a replacement for healthy eating and they won't offer special benefits or protection. I prefer supplementing with individual vitamins, minerals, and specific nutrients to target the specific goal you're trying to achieve. I have a lot of videos on this channel already where I discuss different molecules and their benefits, so make sure you check them out. So,
Who needs a multivitamin supplement?
as I mentioned before, if you feel you need a multivitamin, then definitely consult your healthcare provider and take one. But there are a specific few categories of people that I feel will benefit more than the others. For example, those where the metabolic demand of the body is high, such as growing children, pregnancy and postpartum, peri and postmenopausal women, strict vegans, whether men or women. I know vegans believe food is enough.
But it might not always be. Trust me.
Those on any specific medications, such as if you're taking antacids, if you have had recent surgery done, or if you're recovering from an illness. Those suffering from chronic health-related problems or gut-related problems, since your body is not able to absorb the nutrients from the food effectively. These are just a few examples, but I'm sure you get the gist. Even if you feel you're healthy and fine, and while a well-balanced diet provides sufficient amount of micronutrients, I feel special attention can be given to specific vitamins such as vitamin D, vitamin K, vitamin B12, magnesium, and omega fatty acids. Though every other one like micronutrients such as selenium and all the others are equally important too. But before you go about buying a bottle of multivitamin, there are two important things that I want you to keep in mind. How long do you need to take it, and which one should you actually get? You don't have to take a multivitamin for the rest of your life. I prefer if you take it for a set period of time, such as 3 months, and then give your body a break. And please try to source good quality ones. Try to see what is the source of that vitamin. For example, you can get vitamin C from ascorbic acid synthetically prepared or from extracts of acerola or 𝐂𝐇𝐀𝐏. I will leave examples of the ones I like, use and recommend in the description below. But I would highly recommend you discuss with your healthcare provider since they are your best guides before you try something new. Remember, nobody knows your body better than you do. Take ownership of your health, no matter where you are in your journey. I hope you enjoyed watching the video and gained some new insights. Please like the video and leave your feedback in the comments below. It means a lot to me. And don't keep the video to yourself. Definitely share the video with your loved ones. If you have any other questions, feel free to leave it in the comments below. Continue to glow, thrive and shine. As always, take care.
I'll see you soon.